Hi, my name's Yvette Miramontes. I'm a PA. I've been a PA for almost 20 years. Been working in aesthetic medicine for that long. Today I'm going to be talking to you about one of my favorite procedures, which is threads. And I'm going to be talking to you about Viola, which is definitely one of my favorite thread companies to use. Okay, so this is my setup generally when I'm going to be doing my threads. I like to have my antiseptic and my gauze. I have quite a bit of gauze on my tray because if you get a lot of bleeding, you don't want to have to fumble around for it. So I have gauze that's wet. I pre-wet it with a little bit of my antiseptic spray, and then I have dry gauze. I have my scissors and my forceps or tweezers. I have my marking pin so that I have an idea and the patient has an idea of where I'm going to be placing my threads, and so I predetermine where my vectors are. I use typically 5 or 10 ml syringes when I'm going to be injecting the lidocaine throughout my vectors. My entry points, in order to make it more comfortable for the patient, I typically use a combination of Lida with epi and bicarb in order to bring down the pH and the patient's a little more comfortable. As far as bicarb to Lido ratio, I generally use 0.1 or 0.2 of bicarb, and the remainder will be the Lida with epi. If my patient is not a bleeder, I tend to do lidocaine solely when I do the 5 ml or 10 ml of lidocaine in my actual vector. Some providers do injections only. For me personally, I just find the long cannula to be a little bit more comfortable for both the patient and I. The other tool I need is my 18 gauge needle, because that's going to open the entry point of my port site. And then, of course, my threads of choice. Depending on what area I'm treating, I choose different threads, and I like to have them out so I don't have to go looking for them. I'm just looking for the best vectors to give us the most significant lift. Smile for me. And I do want her to animate because I don't want to do anything where my vector is going to affect her movement at all. Going to do the same thing right along this other side. You can just relax your head. Perfect. All right. And now we numb. And the numbing is the most uncomfortable portion because the pH in the lidocaine is a little different than our body, so it does sting a little bit, but once we get through the numbing, everything else is a lot more comfortable. I'm going to actually recline the chair so you don't move. All right. I'm going to have you turn your head just a little bit. Perfect. And a little pinch. You okay? Yeah. Perfect. ahead for me. Perfect. Stings a little bit. Okay. I completely understand. More numbing, less pain. Okay, hon. Just a little pinch. You okay? Thank you. The tissue in the neck tends to be a little more fibrous, as does the area in the preauricular area, so sometimes it's a little more challenging to get your cannula through that area. Thank you. This is going to feel a little unusual. A little tug. You're doing great. And less is more. I love using cannulas to numb, but you don't want to put an abundant amount of fluid in there, because if not, you'll have a little more swelling. I just need enough in there so that the patient's comfortable when I put the thread through the area. I do about a thread of 0.1. Some people do individual injections. Personally, I prefer not to because I feel like it's a little more uncomfortable, but every provider is different. You okay, hon? You might feel a little push in the back and the scalp. Perfect. Sometimes if I know somebody's a bleeder, I do use a larger amount of epinephrine, but epinephrine can make the patient feel a little jittery, their heart races, and I don't want them to be uncomfortable. So I try to use as little as possible, but if I need to, I'll add a little more epinephrine. Sometimes if the patient's very heavy, I will double up my threads and tie a knot. The only problem with the knot is that sometimes you'll get a little dimpling, and if the patient is impatient, they don't really appreciate the dimpling. So if I can get a good lift without tying, I'll try to do so. If I do a foxy, I generally do tie. Can I have the scissors? Thank you. Feel a little tighter. Okay. Okay. Give me 1 second. So this is how much lifting we've done for you on that side compared to the other. You have some swelling, obviously, because of the fluid that I just injected in there to numb, to make it more comfortable for you. Do you want to take a look in here and see? Okay, we're gonna start with the second side. I'm gonna do the left now, exactly as we did the right. Turn towards me, hon. Perfect, just like that. Okay, so I'm doing my entry points with an 18 gauge. And they're blanched because, again, I used epi. And she's rather comfortable. Same thing, you'll feel just a little pressure sometimes here. Just holding you here. 0.1 ml. Sorry, this is not comfortable. Another 0.1. There's always one side that's a little more uncomfortable, and generally it's the left side. And again, the gauge kind of determines how robust your thread is. Generally speaking, the bigger the gauge, the more robust the thread. And I want a nice lift here for her, so I'm using my 18/100s. The 100 is the length of your thread. If you place it at the right depth, it should have already anchored, but I still like to press down on it and just make sure it's secure. Sometimes people like to put the thread into the actual hair. I'm not a big fan of that because I feel like if I have any hair in my entry point, it could lead to problems in the future. It's convenient because the patient hides it, but it's not worth it to me because I don't want any hair in my entry point. Sounds like a little zip lock or zip tie. Okay. And we all have asymmetry on our faces, so one side's generally a little heavier than the other. Once I've placed my threads on both sides, I like to sit the patient up to see if they're pretty symmetrical or asymmetrical as I can get them. Sometimes I may need to add an additional thread on one of the sides. I feel like this may be the side I need one more thread on. So I'm going to sit her up just to get a quick look of her. Just one more, okay? And turn towards me. All right. Can you feel that? Okay. Just because you said slightly. Just to be uncomfortable. Perfect. Can I have one more 18? Actually, just this is on 18/100. That's where it hurts you. Sometimes, again, I'll tie or I'll twist. And because I really want it to anchor here, I'm going to twist a little bit for her.